Hi everyone. I would like to invite everyone to hear about the crucial subject and an important topic that we need to act upon in the current period, which is mental health. I pray that this session will bring more light to this topic and help people in need. I'm hosting this event on behalf of the IPC Eastern Region Women's Fellowship. The leadership of IPC Eastern Region Women's Fellowship honestly believes that this subject is critical. Mental health is a broad subject and is not much discussed in the community. To define mental health, it includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle the stress, relate to others, and make choices. Mental health is vital at every stage of life. Many factors contribute to mental health problems, which includes biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history of mental health problems, and the list goes on. We often tend to ignore mental health and don't think there is a need to take care of mental health. It's a shame to seek help or share the prayer request with someone. No one asks to pray for their mental health, especially during COVID and after COVID, mental health issues are on the rise. We live in a world where anxiety has become an important issue. It's because of loneliness, separation, financial crisis, fear of the unknown, and so on. We are seeing families who are going through so many mental challenges. Knowing them from before and who they are now are bothering us. More teenagers are coming to the hospital with anxiety, stress, suicidal ideation, issues in the family that affect them like parental separation, the financial crisis in the family, etc. I have some questions that I have collected from families going through tough times. Today, I have Dr. Jacob Palathinkal with me. It's my honor and privilege to introduce Dr. Jacob Palathinkal. He is a psychology graduate who focused his study on creating a novel assessment scale differentiating attention deficit hyperactivity disorder versus bipolar disorder. He has his doctorate in clinical psychology, focusing on children and adolescents. Dr. Palathinkal is a well-known psychopharmacologist who has extensive experience treating children with most complex presentation. He is also a co-founder of the Malayali Mental Health Provider Association, which is an organization focused on reducing stigma related to mental health disorders among the South Indian community. He provides seminars and presentations to various community and religious organizations. He has a private practice on the North Shore of Long Island. Thank you so much, Dr. Palathinkal, to be with us today and accepting our invitation. I encourage the viewers to feel free and ask questions. Just like any other sickness, there is help for mental illness. We have experts in this field who are willing to help you. We will be sharing that information at the end of this video, and please feel free to contact them if you need help. Everything that you share with them will be confidential. Also, if you see anyone struggling, please refer them to all these resources that we have. Together, we can beat this. Dr. Palathinkal, the first question that I have is, how can we identify a person who has a mental health issue?
Many times, identifying individuals with mental health issues may not be so straightforward. Some individuals may be struggling internally, and externally they may be well put together. It's usually the loved ones or someone who cares for that individual who sees the person first struggling. If you see someone struggling, obviously get them help, encourage them to seek help. People in the mental health field who are able to help are obviously psychologists, psychiatrists, social workers. But usually the case is patients usually start with their primary care providers as the initial assessment person.
Yeah, so we all actually can identify a mental health issue. We just have to be there for them. We just have to make sure that they feel that we are there for them. Sometimes, especially now after the COVID, we just have to take off our mask and just smile at them. That's all they need sometimes. So the next question that I have is, an adult or youth seems to be mentally ill and cannot find help. So how can I help, or how can as a community help them?
As you phrased at the last end of the question, being there for the individual, uh, being there and acknowledging that this person is maybe struggling, having them know that you're there for them. Sometimes just being next to a person and providing support is a very good modality of help. And if that doesn't, if that person verbalizes he or she is struggling, encourage them to seek help from a professional. Usually, once again, it's usually the primary provider. If it's a child, it's their pediatrician who may do the referral to a clinician, whether it's a social worker, a psychologist, or any other mental health provider. Depending on what that child may be struggling with, it might be a treatment modality of therapy, or it might be a combination of medication management and therapy.
So as I said earlier, we all will be able to identify a mental health disorder. I mean, that is after the COVID, actually the mental health issues are on the rise, and people, and especially the parents, they are struggling with the kids who are going through so many issues like mentally health issues, not socializing with others. So the next question actually I have is, one of the parent asked, my child was very active in school and church, but now is against religion and does not participate in any activities. How can I help? And that parent was actually struggling through a lot because they cannot find any help.
As you mentioned earlier, there is a crisis, mental health crisis post-COVID and during COVID. And for the same reason, we've seen an intense amount of increase in ER visits for children who are struggling with anxiety, panic symptoms, depression. Now, getting them help, once again, it might be a challenge because there is a shortage of child and adolescent psychiatrists, people who specialize in child and adolescent. A lot of parents utilize the ER as a way of getting into the health system. But the person who should be navigating the mental health treatment should be the primary provider. But if there's an emergency and you feel that your child is unsafe, make sure that you're taking the child to the ER. Sometimes time is of essence. You don't want to delay treatment. But if you're in the community and you are pretty well open and understanding of mental health issues, if the child is not in any safety concerning situation, you could definitely call your insurance company and find providers who are in network and go that route. And going back to the second part of your question, if your child is once an active person in the church, but suddenly refuses to come to church, you want to find out what happened to this person, what has changed their mind about religion. Maybe getting the pastor involved, maybe getting another church member involved and trying to understand what's going on in this person's life that changed their view of religion, support, God, praying, etc.
You just told about the depression. So another question that I have is, what are the signs of depression that actually you can see in a child? I mean, as I said before, COVID has a major toll on that. I mean, a lot of kids are struggling through this depression, and we are seeing so many kids coming to the emergency room with depression, trying to kill themselves, taking medications. So what are the signs that we can actually see?
Some of the baseline symptoms or some of the concerning symptoms we see as parents in our children are isolating themselves, a lack of interest in their day-to-day activity, changes in their appetite, whether it's increased or severely decreased, impaired sleep pattern, whether they're sleeping too much or sleeping too little, lack of motivation, always endorsing low level of energy. not enjoying their day-to-day living or feeling inner emptiness, what we call in psychiatry anhedonia. And obviously the sadness, the affect is flat and constricted, and that person shows no interest in anything. And in children and adolescents, unlike the adults, irritability is a very common symptom of depression as well.
I have seen so many kids coming to the hospital because the symptom that actually they are showing is anger, because they actually lost their parents, the financial crisis in their family post-COVID. So is anger a symptom of mental health?
That question is not very simple to answer, because some individuals may be, depending on the personality, may be somewhat irritable at a baseline. If they're chronically angry and it's impairing their day-to-day living, whether it's not effective at their workplace, they're not able to go to school and socialize, and this anger is getting in the way, definitely seek help. Anger in itself, it's not, unless they're outbursting, they're aggressive, they're angry all the time, they're destructing property, they're hitting people. Those along with anger is concerned. But some people, like I said earlier, are chronically irritable at baseline. And therapy is a very good option for that individual to find out what's going on, what's making them angry. Getting collateral from their loved ones and see if this person is always like that. Has it always been this way? Is this person somewhat distant? So anger in itself depends on the depth or the level of anger, whether it's a mental health issue or not.
How can we help them? Like, what are some resources that you have to stay connected? Or what should I do? Or what should we do when we think that someone is feeling like lonely in their life?
We are blessed with church in our community. That's always getting them involved into activity. But someone who's lonely and depressed, they might not find the motivation to come to church or speak to someone because of fear of confidentiality, church talking about it, all this concern of their own. The best thing to do, if that individual is willing, is to find a therapist for that person. Have a neutral person who does not know this person from any other aspect except in that office, and have this person speak to this individual in a professional manner, knowing that all this information will be kept confidential. That might be the best way to approach a believer, a co-believer, or family member who might be struggling.
So in your day-to-day life or in your day-to-day practice, what are some challenging issues that we face or see in present world that we need to address?
During COVID, and I don't like to use the term post-COVID because we still have some COVID cases going on, but we have seen an immense number of anxiety cases increasing, whether it is going back to the reality of attending school in person. There's an increase in case of school refusal. There is an increased number of panic attacks. Individuals who had subclinical symptoms pre-COVID, now it's sort of, there's a surge in their symptoms that they're coming to the ER or seeking mental health treatment. So one of the things that are on the rise is anxiety-based disorder, whether it's generalized anxiety, whether it's social anxiety, whether it's panic disorder, whether it's OCD. So we see an immense number of anxiety-based disorders on the rise.
Yeah, so as you said that there are so many kids now are actually withdrawn child. So some of the parents, they are asking like, should I just pray or should I just seek help from a mental health provider? Or should I just go to my primary care provider? Or should I just go to my priest or my pastor to pray? Because some of the kids, some of the parents, they don't want to open up in front of their own priest or pastors because they know them very well. So how can we help them? Like that is a challenge the parents actually face right now.
Right. Seeking the assistance of a pastor or a priest or whoever the religious leader is a good idea if you're comfortable approaching that individual. But many times the pastors and the priests and other religious leaders who I've spoken to, they feel somewhat limited in how much they can offer. Obviously, prayer is a very good tool in connecting with the divine and opening up to someone who's non-judgmental and knowing that God is the ultimate healer. And research has been done over and over again on the benefit of praying. There's been various studies at Harvard and other universities that shows that prayer is equivalent to mild modality of psychotherapy, and you've seen a reduction in symptoms. But when the symptoms become concerning and it's impairing that individual's day-to-day living, and you're not sure where to seek help, I would probably call the primary provider first and ask them for their suggestion. And obviously, some concerns is that when there are psychiatric symptoms that may have other medical reasons why they're having these symptoms, such as some of the common issues in depressive individuals. I shouldn't say common. There are some children who may be presenting with depressive symptoms, but they may have hypothyroidism. So you want the pediatrician to do some basic blood work, such as the thyroid profile, to rule out hypothyroidism. But once that comes back, and if there's nothing medically going on, that pediatrician may refer the child to a therapist. And if the therapist feels that the depressive symptoms are not improving after a certain number of sessions, the therapist may refer that child to a psychopharmacologist for a psychiatric evaluation. At that point, depending on the severity of the depression, that person may prescribe medication for treatment.
As you said, that the stigma associated with the illness is actually preventing the families from seeking help. So are there any reason that you think some people are hesitant to seek help, or why there is a stigma associated with that sickness in our community?
Right. So stigma is something that has been passed on from generation until this point, especially in the South Asian community. Mental health is looked upon as a curse, a punishment from God, something that the individual has done sinfully that he or she may be suffering. These are old view of looking at these things. Mental health treatment and diagnosis is just as equivalent as if you're having a medical illness. If you're a diabetic, you're going to take insulin and oral hypoglycemics. And generally, people don't feel bad about it. It's a medical issue. People should start looking at mental health issues in the same lens as it's a biological imbalance. Our body is made to be broken down at point and times. And if you could look at mental health issues in the same model as the medical issues, I think some of the stigma can be alleviated or reduced. And one of the things that I always recommend is that as parents, if we talk to our children about mental health and make them aware at this age, do not be ashamed of it. This is part of living on this earth. And hopefully the next generation would be less stigmatized towards mental health issues. They'll be more open to talking about it. That's my suggestion to reducing stigma.
So what is actually happening is that the psychiatric disorder is always considered it's something like, okay, someone is labeling you as a psych patient, that is lifelong. Someone knows that you are going to a psychiatrist or you're going to a mental health provider. So, and you're taking psych medications, and that that is lifelong, and people label you as a psych patient. And people don't want to hear that. And that is why sometimes people feel that, sometimes people are hesitant to seek help. So thank you.
Not all individuals who are on psychiatric medication need to be on it for lifelong. Individuals who may be going through symptoms that are temporary, whether it's during grieving process, someone passed away and you're grieving it, but there's depressive symptoms, or they may have an acute symptom of anxiety. So not always individuals who start psychiatric medication need to remain on them for the rest of their life. There are temporary treatments, whether it's medication and therapy.
That's a great answer. People don't know that. Sometimes people think that once you start taking psych medications, that is lifelong, and it affects them somehow. And
definitely,
and they're.
I mean, generally speaking, when we start children on medication, the standard of protocol is when you start a child for anxiety or depression with an SSRI, You try to keep them on for anywhere from 9 months to 1 year. Then we talk about tapering off the medication, hoping that they have gained enough insight from therapy and they'll be able to utilize the coping skills learned in therapy and move forward without the aid of medication. But at the end of the treatment, if that child has rebound symptoms and the symptoms return after coming off the medication, it's a very good indication that the child or adult may need a longer term treatment. And there's no need to be ashamed of it. You have to understand that looking at this mental health issues from a biological perspective, just as a diabetic patient has low insulin levels, so their blood sugar spikes. A person with depression or anxiety has low level of serotonin or dopamine in the brain, so they're feeling these symptoms. If you look at mental health issues from the same perspective as a medical model, you'll be less inclined to look at mental health in a negative way.
That's a great answer, because people didn't know that. And that's something that we can actually give that information up to the community, to other people, so people actually will seek help. So Dr. Palathinkal, the last question that I have here is, how can we change the way people think about mental health issues and help them in the earlier stage?
Sure. Depressive symptoms or anxiety symptoms prolonged and this individual is suffering with it, he or she may look at other alternative modality of interventions to feel better. If you're the loved one and you see that this person is struggling, early treatment has better outcome, long-term outcome, versus individuals who struggle for 30, 40 years and has not gotten any help. That individual becomes hopeless to the point of sometimes saying, what's the purpose of this life? I might as just well end it. Finding help at a right time, getting them support. Sometimes it might be very difficult to convince this individual something is wrong with them. But being there for them and making them aware this is not normal to feel depressed all the time. It's not normal to not to attend school daily. It's not normal not to go to work. It's not normal to fight with your spouse every day. It's not normal to be abusive towards your children. Normalizing and making them aware some of these behaviors are not normal day-to-day feelings, making them aware that there is treatment out there, getting them the right help. It's important. And as I mentioned earlier, since this COVID struck, there has been a crisis in mental health and shortage of providers. One of the common questions I get from the community is, even from the pediatrician, where do I refer this child to or adult to, because nobody's accepting new patients? If that's the case, you should really seek out your insurance company if you want to stay within network, within your insurance, and find out who are the providers who I could take my child to. Sometimes by word of mouth or referral, a friend or somebody from the community may refer you to someone. That's great. Many times people come to my office because of word of mouth, from a school counselor, from a priest in the community, a pastor in the community. So there is shortage of providers, but if you look hard enough, you will find providers for your loved ones.
Thank you. And also, I just want to encourage the viewers. Dr. Palathinkal, he was talking about some of the resources that we have. Can you please explain a little bit more about the Malayali Mental Health Association that you are part of, so
Sure.
people can actually get help?
Yeah. So myself and Dr. Julie Syriac, she's a child and adolescent psychiatrist, we started this organization called MMHPA, which stands for Malayali Mental Health Provider Association. This was started about 3 years ago, roughly. We came up with this because we realized the stigma attached to mental health issues in the Malayali community. We have a list of providers who are social workers, psychologists, psychiatrists, and nurse practitioners who are willing to see individuals from our community. Once again, many of us are not accepting clients at this time, but if there's an urgency, we could always help, at least direct you to the right person. So MMHPA, at the end of this recording, Dr. Shinu will share with you the referral source that I have shared with her. There's a list of providers, plus there's also a list of community agencies that you could contact for help for your loved one. Once again, all this information that we're providing you is to help the community in understanding that mental health is just as important as medical issues, and seeking help at an earlier stage and accepting help and knowing that there is help out there and you have a bright future with getting help rather than continue to struggle.
So much, Dr. Palathinkal, for your time. I encourage the viewers to just reach out to all the resources that we have. We are providing all the information at the end of the video, so you can reach out to those resources and get help. Thank you. Thank you so much, Dr. Palathinkal. I encourage all the viewers to please reach out to us with any questions. Dr. Palathinkal can also refer you to other resources. You can email him or you can call him. The contact information will be provided at the end of this video. This is the time we should rise as a community for our fellow beings. There is so much help available. Let's break the stigma. Please reach out, seek help, seek prayer. He is there for you no matter what you are going through today. We are also here to pray for you. There is nothing impossible with God. In John 13:34 to 35, it says, "A new command I give you, love one another. As I have loved you, so you must love one another. By this everyone will know that you are my disciple if you love one another." It is very essential as a believer. We do not judge, we do not criticize, we do not put down anyone who is going through mental illness. Instead, as Christians, we can help them, show kindness and love them. God loves you, brother and sister. Please feel free to ask questions in the comment section. We will be coming back again to answer those questions. Once again, thank you everyone for taking the time to watch. God bless you.